Everyone who's just joined us on Facebook Live now. What we're going to do now is just do a quick scan through some hamstring assessment methods, like initial objective assessment. Okay, so what we'll start with, basically should start by saying that we're not going to test both limbs today, just on appearance of the video. So every single time we do assessment, just make sure you do test the non-injured limb as well when you do test it first, so the patient knows what to expect from the test, and that you can use it as comparison as a baseline for your testing as well. So we'll start with our patient position in prone, our athlete position in prone. What we'll do first is observe, so we look for any signs of swelling, any bruising, just looking at the muscle. Does it look normal? Is there any deformity within the muscle? Is there anything that we're worried about there? We'll then move on to palpation. So again, looking for heatness, looking for anything that in regards to disruption in muscle structure. Obviously, then while we're in prone, we just use this opportunity to try and see if the athlete can activate the muscle and generate the force. So we'll start with the knee inflection. So we test an inner range. We ask the patient to just bring the heel towards their bum, so we resist the movement. Okay, perfect. And then to progress this test, if you're comfortable with this test, we'll move them to the outer range. So repeating the same test and pushing up against my hand. Perfect. If we're happy with this testing, then we'll just ask the athlete or the patient to turn around. So move on to our test that we can complete in supine. We'll start with the muscle length testing. So we'll start in position of 90 degree hip flexion and knee flexion. What we do next is we passively extend the knee and we look at the popliteal angle. That's more flexible. so we look at the popliteal angle. Obviously, for more objective outcome measure, we can use the goniometry or inclinometry. Next, if we're happy with this testing, we'll try and do a straight leg raise to look if there's any neuro involvement. We'll look at the straight leg raise in regards to where the symptoms start coming in, so we'll wait for the reaction from the patient or where they feel the pain and feel any symptoms at all. But then the first bit of range, so like 0 to 30 degrees of a hip flexion, then will be more of the indication of a disc related problem. Moving up, so 30 to 70 degrees, we may be looking more on peripheral nervous system and basically just sciatic neural component to the symptoms that the patient is presenting. And above that, okay, maybe just muscle length that we've seen for Johnny may be an issue, but we're looking more like hip related, SIJ related problem there. Okay, from this position we'll move on to more functional testing, so we'll do some Bridget matrix. Start in a position where we do test and double leg in an inner and outer range, to then move on to single leg testing in an inner and outer range again. So in inner range we'll be using glutes more. In outer range you kind of put more stress on the hamstrings. Okay. We'll then move on to some testing in standing. So just to check our adaptive magnus involvement, we allows them to complete the goblet squat. So it's basically due to the fact that adaptive magnus is involved in hip extension movement, and it's quite closely associated with the hamstring muscle of the group. As such, we'll then move on to do divers and windmills to have a look how they can accept the eccentric load, just find the table, and control the rotational forces. Okay, so 2 tests, windmill and a diver. Good, perfect. And then we'll move on to jogging on the spot. So we'll see if the athlete is able to complete that. From jogging on the spot, we'll ask them to jump on the spot and do little hops on the spot as well. If they're able to complete that test, we'll then actually ask them to do some kicking, so more sport specific if they're a football player. And then obviously the extent to, or the amount of tests that we can complete will depend on the extent of injury. So it may be that we're not necessarily going to go fly through the full assessment process that we've done just now. You may need to stop a bit earlier depending on how your patient or how your athlete is presenting. Thanks for joining us.
See you later.